Hello, and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us once again. I'm going to be speaking with Dr. Mark Bruce this evening about the geographic disproportion of the new COVID-19 cases, how the United States has most of the cases, and he's also going to touch a little bit about herd immunity. He's the author of the book, Jackie, A Boy and a Dog, A Warm Cold War Story. Welcome to Health Professional Radio, Dr. Mark Bruce. Thanks for taking the time.
Well, it's good to be with you, Neil.
Give our listeners a bit of background about yourself. What's your area of expertise?
I'm an emergency medicine physician, and I do a lot of international work, too. Okay. I've been involved with a lot of disaster relief work in the Asian disaster zones, the tsunami-affected area, and also the West Sumatra earthquake zone, but kind of done a lot of medical work around the world. I'm currently the American College of Emergency Physicians Ambassador to Belize and also to Canada.
And you're also an author, the author of the book, Jackie, A Boy and a Dog, A Warm Cold War Story. Is that your first work?
It's my first book. This is a story that has followed me, for the last 57 years. It's a true story, and it's a story that is about the relationship that I had starting at age 10 with Jacqueline Kennedy and then Jacqueline Kennedy Onassis after Jack was killed. But it's a story of God's grace in my life, how God used Jackie as an instrument of his grace, preparing me to do the same for so many people that I've been able to touch in my medical work around the world.
Now, 40% of the world's new COVID-19 cases seem to come from the U.S. What are your thoughts on it? Is there a disproportionate geographical increase in COVID? I mean, is one place more susceptible, and why? What's going on here?
Well, this is a very, very contagious disease. 4 months ago, we knew nothing about this. As far as we knew, it didn't exist. So we're kind of playing catch up in terms of gathering a lot of data and learning more and more about this. The average person who gets COVID is going to give it to 3 other people. If you do the math on that, over a 2-week period of time without any mitigation efforts, that would allow that one person to infect 4.7 million people.
Wow.
And so it is highly contagious. But I'll talk a little bit about that kind of in perspective whenever we get to kind of the herd immunity aspect of this, which is so important and will be very, very important in terms of containing that.
What is herd immunity? We've heard some speculation from some of the daily update panel, as it were, on different networks, talking about the possibility of once you have it, you're immune to it, maybe not. What is herd immunity?
Herd immunity is where there's a critical mass of people within a population that have had a disease, not just coronavirus, but any disease, and have either recovered or they have been vaccinated for it, so that as a group of people, that group of people is relatively immune from that disease process. I'll give you an example. Measles is much, much more contagious than what COVID-19 is. The average person who gets measles will give it to anywhere between 12 to 18 people. But, we don't have a pandemic of measles. We have a pandemic of COVID-19. The reason we don't have a measles pandemic is because we have good herd immunity. That is, the population has either been vaccinated, we've got a great vaccine for measles, or they've had measles and have recovered. And so they've got a good immune response to that whenever their body sees it again. So that imparts that population immunity, or that herd, as in like a cattle herd, the whole group of people basically have protection because of that. It does require, though, about 83 to 90% of the population to have either been vaccinated or to have had and recovered from the disease.
So when we have a situation like this, there's so much controversy around what should have been done, what should be done going forward. Where do you say that we go from here? I mean, a lot of us are going to pass away. That's something that we need to get our head wrapped around. It's very hard to get our head wrapped around that, but it's still a reality. Where do we go from here?
Well, I think it's important to kind of keep this in perspective. There are much more deadly viruses than what COVID-19 is, even within the same family of coronavirus. The SARS and the MERS epidemics were much more lethal in terms of their death rate that they had. I was over in Asia during the SARS epidemic, and I saw that up close and personal. And it was literally about 5 to 7 times more deadly than where we expect the COVID-19 death rate to be. Any loss of life is tragic, and I don't want to minimize that, but we expect the death rate is probably going to be between 1 and 2% with COVID-19. It was between 9 and 10%, and in some studies was upwards closer to 14 to 15% in some of the SARS studies that came out. So it's with that in mind, we're not all going to die of this, and this is something that is the challenge with this is the contagiousness of it, and we know the people that are particularly at risk for developing this. And with any type of outbreak, any type of epidemic, the first rule is to protect the uninfected. And that's the challenge with this particular entity, is this novel virus is so contagious that it has been difficult to contain within any non-vulnerable population. So that's why that's how you keep an outbreak from becoming an epidemic, is protecting the uninfected. That's how you keep an epidemic from becoming a pandemic, by protecting the uninfected. And it's how you contain a pandemic once it's in place.
In view of SARS, Legionnaire's disease, Ebola, even considering some of the mishandling that we hear that occurred within the Chinese government and the Chinese medical community, why do you think there was such a sluggish response by the Western world to this COVID-19 situation when we've had experience before?
Yeah, it's a great question, Neil. And I'll tell you that our memory of SARS in particular, and MERS, but SARS in particular, was very dim because it did not affect us. Whereas the Asians, they were up close and personal to that. And so they saw two things whenever COVID-19, when there seemed to be unconfirmed person-to-person, human-to-human transmission of COVID-19, they immediately recalled SARS, because they saw China mishandle SARS. It came from China. They saw the misinformation from China, and they didn't trust anything that was coming out of China as it relates to this current pandemic. So they very quickly reacted. Their reaction was robust. You look at South Korea, you look at Taiwan, you look at Singapore, you look at Bangkok. All of them reacted and were able to kind of get their arms around us much faster than us, because they knew what was coming, or they had concerns over what was coming, and they did not trust the information that was given to them by China or their surrogate, the World Health Organization. So that's part of the reason why, is that the Western world was, I think, maybe a little bit less skeptical, I guess, about what was coming from China. And also, they didn't remember SARS. So that response is not unusual.
Where can we get some good information, some good updates about what's going on with the COVID-19 pandemic as it relates day to day? It's changing hour by hour, day to day.
Well, there's every day the president and his task force are doing briefings. They're giving very good information. They're giving the latest data. The coronavirus.gov website is very good. You can go there directly, or you can link to that from the cdc.gov website. Those are all very, very good resources to tap into as it relates to this, as well as your local your own medical community locally. Feel free to call your doctor and discuss with them if you're having any symptoms that you're concerned about. They may not be as available in person as what they were, 6 weeks ago, but they're certainly still available.
Where can we get a copy of the book Jackie, A Boy and a Dog, A Warm Cold War Story? Where can we get a copy of that? We've
got a great website. It's very robust with a lot of media. It's called JackieBoyDog.com. And there's Audi Automobiles did about a 10-minute documentary on this story a couple of years ago. That documentary is linked up there. There's some other media that are there, but there's a bookstore that's on the website, as well as links to Amazon and to Barnes & Noble. But if you buy the book from the website, I love personalizing the book, and there's a way to kind of send me a message there in terms of how you would like for me to sign the book, and then we ship it out. So that's any of those stores, but it's available through any bookstore now too. So.
Well, I thank you for joining us here on Health Professional Radio this evening. It's been a pleasure, Dr. Bruce.
Well, thank you very much, Neil.
Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.